Who's actually going to get the most out of a 32-inch medical-grade monitor, and who can safely walk away without spending a premium? If you're a surgeon, interventional radiologist, or any clinician who spends hours looking at high-resolution imaging, you'll want to know whether the LG 32 Medical IPS 4K surgical monitor delivers the clarity you need without turning your operating room into a cost center. And if you're a general practitioner, or a clinic that just needs a decent display for patient charts, the question is whether the price tag makes sense for everyday use. Link is in the description if you want to check the product details on Amazon. First, let's talk about the hesitation that most buyers feel. In a world where you can get a consumer 4K TV for a fraction of the price, the idea of shelling out for a specialized surgical monitor feels risky. The fear is buying a piece of equipment that looks impressive on paper, but ends up being a vanity item that adds little to patient outcomes. On the other hand, the risk of using a low-grade screen in the OR is real. Misreading an image by a fraction of a millimeter can affect surgical precision. That tension is what makes this review worth your time. The LG 32 medical monitor is built around a 31.5-inch IPS panel that pushes a native resolution of 3840x2160. What that means in practice is that the pixel density is high enough to render fine anatomical detail without the graininess you sometimes see on standard HD monitors. In a typical orthopedic procedure, for example, a surgeon can zoom into a CT slice and still see the trabecular pattern of bone clearly, reducing the chance of misperception that could lead to a misplaced screw. The same clarity translates to cardiovascular imaging, where distinguishing a subtle plaque from surrounding tissue can guide a critical decision. One of the biggest practical strengths of this monitor is its wide viewing angle, a hallmark of IPS technology. In an operating room, the surgeon isn't the only person looking at the screen. Assistants, anesthesiologists, and sometimes even trainees need a reliable view from different positions. Because the colors and contrast stay consistent even when you're standing to the side, the team can maintain a shared understanding of the image without constantly rotating the monitor or crowding around a single spot. That collaborative benefit is hard to quantify, but anyone who's been in a cramped OR knows how valuable it feels. HDR10 support is another feature that often gets lost in the hype, but actually matters. When you're reviewing a contrast-enhanced MRI, the dynamic range provided by HDR helps separate bright contrast-filled vessels from surrounding soft tissue, making the edges crisper. In practice, a radiologist who toggles between standard and HDR modes can spot a small aneurysm that might otherwise blend into the background. It's not a magic bullet, but it does give an extra visual buffer that can be the difference between catching an anomaly early or missing it. Connectivity is where the monitor shows a pragmatic side. It offers both HDMI and DisplayPort inputs, plus USB ports for easy integration with imaging workstations and PACS systems. The DICOM compatibility means that you can feed the monitor directly from diagnostic equipment without worrying about format conversion. For a busy surgical suite that swaps between ultrasound, fluoroscopy, and endoscopic cameras, having a single display that handles all those inputs without lag is a real time saver. That reduces the need for additional adapters or signal converters that can clutter the space and introduce points of failure. Now, let's talk about the trade-offs that could make you think twice. First, the size. At just over 31 inches, the screen is larger than many standard monitors, but still smaller than a full-size TV that some clinics might already have on hand. If your operating room is already cramped, fitting a 31-inch unit with the required mounting hardware can be a squeeze. You'll need to plan the layout carefully, especially if you want the monitor mounted on an articulated arm to keep it out of the sterile field. That installation step isn't a deal-breaker, but it does add a layer of planning that a plug-and-play consumer TV doesn't require. Second, the price point. Medical-grade monitors carry a premium because they meet stricter calibration standards and often come with certifications for clinical use. If you compare the LG 32 Medical to a high-end consumer 4K monitor, the cost difference can be 2 or 3 times higher. For a solo practitioner, who only occasionally reviews imaging, that extra spend may not translate into a measurable return on investment. The monitor shines when you're consistently using 4K imaging in high-stakes procedures. Otherwise, a cheaper alternative could cover the basics. Third, while the HDR10 support is useful, it's not the same as the professional HDR standards you find in cinema-grade displays. The peak brightness is tuned for medical environments where glare and ambient light are tightly controlled. If you try to use the monitor in a brightly lit conference room, the HDR effect can look muted. So it's best kept in a controlled lighting setting, which most stores already provide, but it's a note for anyone thinking of repurposing the screen for presentations.